Sam Potter is a 40-year-old transgender male who was admitted yesterday morning for a fall and lacerations treated with stitches. The patient is complaining of chest pain all over, dyspnea, and anxiety. Background information: sex female, gender male, transitioning from female to male, started hormone replacement therapy January 2016. This patient is allergic to iodine and ink. He is a full code and standard isolation precautions. He has a history of anxiety, varicose veins, gender dysphoria. Surgical history: outpatient vein stripping for varicose veins. Home medications include ibuprofen, multivitamin, Loestrin 20 micrograms PO daily, Ativan 0.5 milligrams PO PRN, and testosterone. In the MAR, his medications include morphine PRN for pain, Ativan PRN for anxiety, continuous natural saline 125 milliliters per hour, and multivitamin. Assessment: his vitals included blood pressure of 85/65, heart rate of 126 beats per minute, temperature 99.5 degrees Fahrenheit, respiratory rate 35, and SaO2 87%. The ECG shows sinus tachycardia. The labs showed that the D-dimer is elevated, and his IV is clean, dry, intact, and absent of erythema. It's an 18-gauge IV that is patent. For head, ears, eyes, nose, and throat, the pupils were round and reactive to light and accommodation. Conjunctiva pink, no icterus present. The nasal mucosa is non-inflamed, no drainage from nasal passage, and the external auditory canal is clear. For the throat, the mucous membranes were pink and moist with no breakdown. For the skin assessment, no skin breakdown was present. The skin is evenly pigmented throughout and is clean and dry. Psychosocial: this patient has not been eating, is agitated, restless, and has been experiencing insomnia. Neuro: this patient is experiencing syncope and dizziness. He is alert and oriented ×4 with cranial nerves 2 through 12 intact. His gait is unsteady and requires one-person assistance out of bed. Cardiovascular showed that he has sinus tachycardia, no extra heart sounds or murmurs heard. Pulses are diminished in all extremities. No edema is in the extremities. He is hypotensive and reports of chest pain. Respiratory shows tachypnea. Accessory muscle use can be seen. All lobes of lungs are clear to auscultation. No cyanosis, clubbing, or barrel chest noted. GI: no abdominal pain. GU voided 3 times and reports no urgency. Or dysuria: requires one-person assistance. MSK is deferred because the patient is hypotensive and dizzy. For my recommendations, I would recommend that this patient, that the following diagnostic tests should be ordered: a chest x-ray, a VQ scan, and pulmonary angiography. I would also recommend to start anticoagulation therapy and implement care as prescribed by the doctor, maybe like a heparin drip or warfarin. I would also monitor for a sudden headache, coffee ground, emesis, bleeding gums, and hematuria, stuff like that. And as always, I would put a fall precaution in place for this patient because he is experiencing dizziness and is hypotensive. And that is it for my patient report. Do you have any questions for me?